Health Secretary Neil Gray inherits the brief at a hugely challenging time. Following last week's resignation of scandal hit Michael Matheson, Gray has been given the job of turning around a struggling health service. From accident and emergency waiting times to warnings over a two-tier NHS, the scale of the challenge means Gray's ministerial abilities will be tested. So what will he bring to the role and what's his vision for fixing our NHS? He joined us this afternoon to share some of his thinking. So what are you going to do differently from Michael Matheson?
So I think I'm inheriting from Michael an NHS and a social care service that's in recovery from the pandemic, from the impact that Brexit has had on our workforce and the impact that the financial pressures that there are across the public sector in the UK after the spiralling inflation that we've all been facing. So I'm going to be looking at some of the plans that Michael had to see reform and to see continuous improvement and to ensure that it continue to drive down on waiting times, whether it's the front door at accident emergency or cancer waiting times or indeed inpatient and outpatient long waits. And that's going to be my focus. I'm obviously in listening mode, listening to what colleagues in government and staff and unions are going to be telling me, but I'm going to be, those are going to be my priorities. OK, a couple of things. You talk about waiting times. So 63.5% of patients were seen within 4 hours in A&E. That's figures from this month, miles off the 95% target. I mean, what can you do to tackle that? So today I was at the Queen Elizabeth Hospital with NHS Greater Glasgow and Clyde, and what they're doing, and I know that other services across Scotland are looking at this and some are implementing this as well, is looking at having a better patient flow and having a virtual accident emergency. So when calls are coming in through ambulance service or through NHS 24, there is a specialist team that are triaging some of those calls, making sure that people are getting seen in the most appropriate place. Is that not already in place in many hospitals, this triage system? Yeah, some of that and it doesn't seem to be impacting on the waiting time. It is improving. It is improving, both in terms of the waiting times and in terms of what's most important, which is patient outcomes and patients actually getting to see the people that they need to. So rather than going to accident emergency and spending time there waiting to be told that your condition either could be managed at home or you're better seeing a pharmacist or someone in primary care, actually getting access to that in a much faster way through this triaging process. We'll continue to work with boards around how we can continue to see improvements around accident emergency. But of course, we have to recognise that in spite of those challenges, for the eight years, the A&E departments in Scotland have performed better than anywhere else in the UK. Well, we're talking about Scotland here. Let's concentrate on that. But it's important to recognise the context because the pressures are the same across Scotland. If you're sitting waiting in A&E for more than 4 hours, you don't really care about how long someone's waiting in England, do you? You don't care about the context. I grant you that, but I think when health boards across the UK are facing the same pressures post-pandemic. Let's talk about bed blocking in the NHS because nearly 2,000 beds were blocked due to delayed discharge in December. That's a big problem, isn't it? It is. It's an issue and one that obviously I'm going to be looking to work not just with our boards and our social care partners at how we can see improvements there, because it's important that where there is a need for a bed, people are able to get access to one, but also people have better outcomes when they're able to get home and we're able to see their time spent at home. That's what we're obviously looking to try to get more of. So in practical terms, is it about getting more carers? Some of it is going to be about that, making sure that we've got capacity, and I'm very interested in what we can do to improve capacity across the health and social care sector. You pay them more, that you'd attract more carers then. Which we're doing, of course. We've invested. Get paid more in a supermarket in many cases. We've invested, it's not an insignificant amount, £230 million in bringing up, giving a 10% increase to social care staff, bringing that wage up to £12 an hour, which is really important. It's a record increase. And we'll continue to do what we can, including at rolling out more hospital at home service, which is having a really good impact at getting people into their home, getting the care packages in place and continue to see their support provided there. Why is the National Care Service, which was intended to simplify the social care system, why is that being delayed by 3 years? Surely this is the kind of big idea, the big reform that you need. So I'm hopeful that we can make progress on that, and there's been good negotiations ongoing with the likes of COSLA and others in order to see a bill come forward that people can work with. And I think the delay that's been brought about is to make sure that we can listen to key stakeholders around the ideas and the way that they would want to see a national care service operate. That's where we've taken the delay, to make sure we're listening and implementing what is best for people and for those that are going to be delivering the service. The national care service is about making sure we have a more uniform approach to a high standard of care and indeed of working environment, and making sure that we can provide that across Scotland while still having a localised input and getting that balance right for people.
Are we heading for a two-tier health service? Now, I know you have been asked this already and you say we're not, but statistics seem to suggest that we are in a two-tier health service. Age Scotland published a report last August showing that 30% of older people have either paid for or would consider paying for private health care.
And obviously that's not acceptable. That's not where I want us to be. I want to drive down on waiting times, both for inpatient and outpatient surgery, and make sure that we're able to deliver the service that people need as quickly as possible. I think reasonable people recognise that we've just come through a global pandemic, which has had a significant impact, not just on the service delivery, which is important, but also on the impact of people's health. People are presenting with more complex...
what I'm kind of getting at is you can't deny that we're in the middle of this two-tier service already. I mean, you must know people who've gone privately to pay for an operation. I know many people that have.
No, so I think for the majority of people, they have a very good experience with our National Health Service. I want to make sure that it continues to improve.
Then?
Well, I think people have their own choices to make around where they feel that they need to go down the route that you're suggesting. I want to minimise that. I want to make sure that people aren't in that position. There are challenges across our health and social care system. I don't think anyone is denying that. I'm certainly not. What I'm focused on doing is improving and continuing that recovery work to ensure that fewer people are having to go down that route.
Politically, you and other political parties can't really deviate from this mantra, free at the point of care, can you? But when the NHS started in 1948, it was a different world, wasn't it? I mean, now we've got an ageing population, we've got expensive drugs, better cancer treatments. You know, shouldn't we be realistic about what we can afford to provide for free? Shouldn't we have a conversation about that?
So I'm absolutely committed to having an NHS and a healthcare system that is free at the point of need. That is absolutely essential.
But do you think even going into the future that's still going to be possible when the problems are just going to get harder?
It's essential for the social contract that we have with our citizens, and making sure that we continue to have a health care system that is the envy of the world. Of course, there are discussions elsewhere in the UK. We already see what is happening with the privatisation of NHS England under the Tories, and Wes Streeting, Labour's shadow health secretary, said he's going to open the front door to the private sector. I want to make sure that we have an NHS, a health and social care system here in Scotland that continues to be free at the point of need, and that increases capacity to ensure that we're able to respond to the needs of the people of Scotland.
We've also got a problem with dentistry in Scotland. Almost 82% of NHS dentists in Scotland are no longer taking on new patients, and 83% say they'll reduce their NHS numbers. So it's getting harder and harder to get NHS dental care.
And we've still got a situation where 95% of the Scottish population are registered with a dentist, and we're doing what we can to take steps to improve the position for dentistry in Scotland. We had the renewed pay situation in November last year, and we'll continue to keep under review the situation there. Of course, there are pressures across our public services. We recognise that. It's not just unique to Scotland, it's a situation for the rest of the UK and wider, but we'll continue to do what we can to invest in NHS dentistry as well. On
a different subject, council leaders today are saying they're in fundamental dispute with the Scottish Government over the council tax freeze. Relations have really broken down.
So there are political discussions underway, obviously, as you'd expect. The Deputy First Minister, Shona Robertson, is leading that in terms of the offer of the finance that we have provided, almost £150 million in terms of maintaining a 5% funded freeze.
Because it says the council tax freeze is not fully funded.
Well, we're funding 5%, and it's obviously those discussions are ongoing. And there's obviously been some political discussion today around some of the political leadership across Scotland as to whether or not that is sufficient. My encouragement is for there to be continued discussions and negotiations around that, because this is a critical time for people with a cost of living crisis.
Should the Scottish Government not have consulted with the councils before they imposed this council tax freeze?
So we're discussing now around how...
Well, now you are, but you didn't at the time. Hamza Yousaf made that announcement and the council didn't know anything about it.
So I think it's important that those discussions are ongoing. We'll do that in good faith and make sure that we arrive at a position that I hope will see the council tax frozen across Scotland. So it was okay
just to go ahead and make this announcement without consulting with council leaders?
The First Minister made that announcement because of the situation facing people, and this is an area with a cost of living crisis. This is an area that we have an ability to help individuals and households across Scotland through a cost of living crisis, and we know from polling that over two-thirds of people support the action that the Scottish Government is taking.
Neil Gray, thank you very much indeed for joining us in Scotland tonight.